Do you currently suffer from knee pain? In this video, I'm going to tell you how to address pain around the kneecap with some education on stress and exercise selection.
Patello refers to your patella, also known as the kneecap, and femoral refers to the femur. The patellofemoral joint is where these two bones meet. Patellofemoral pain refers to a pain deep to the kneecap as a result of repetitive damage to the posterior surface of the patella as it glides over the anterior surface of the femur. Normally, the patella glides smoothly over the patellar surface of the femur. If alignment of the patella changes as a result of trauma, limb malalignment, or repetitive stress, it no longer moves smoothly within the knee joint and therefore becomes damaged and inflamed. Pain and stiffness associated with this condition can cause younger patients to modify their sports activities. This type of pain is usually non-traumatic in nature, with pain present behind the patella when squatting, running, jumping, or going up and down stairs. Here I'm ruling out any ligament or meniscus damage in the knee by performing some provocative knee tests. My client felt no pain during the ligament test, however felt 5 out of 10 pain at the top of the knee when I performed knee flexion in end range. We have to understand that stress is neither good or bad, but has to be appropriate for the context. If you want to stimulate hypertrophy, you have to stress your muscles. If you don't stress them adequately, they atrophy. If you overstress them, you can get rhabdomyolysis, a serious medical condition caused by proteins and electrolytes being released in the blood from damaged muscle tissue. This can be fatal or result in permanent disability. To improve bone density, you stress your bones, and if you don't stress them enough, it could lead to osteoporosis. If you overstress them, you may get a stress fracture. You get the point. Similarly, there are no good or bad exercises for your knee. They just have to be appropriate for you. There's not a single path that everyone has to follow because we all have different starting points and goals we want to achieve. The goal is to increase your capacity and tolerance to different stresses over time. I've put together a plan for my client to follow over the next few weeks, which include lateral step downs, step ups, VMO and hamstring activation, active range of motion drills, and other bodyweight exercises to encourage range of motion with progressions in weight so stress is appropriately introduced. These sets of exercises may not be appropriate for everyone. As I mentioned before, we all have different starting points for our injuries. In this clip, I'm just getting my client to perform some heel slides. Heel slides are simple leg exercises that involve extending your leg away from your body and bending your knee and sliding your heel towards your bum. You can do heel slides in bed, on the floor, or the wall. They're often recommended after having a knee injury or knee and hip surgery. You can also use heel slides to prevent and treat lower back pain. The purpose of heel slides is to increase the range of motion of your knee, and they also help to strengthen and stretch the tissues around the knee and leg muscles. This is an important part of the recovery process and helps to prevent further injuries. Some rehab examples for patellofemoral pain may include a focus on quadriceps strength, additional strength, dynamic balance, and some optional plyometrics. For quadriceps strength, you can do a variety of split squat progressions, step down progressions, and leg extensions. For additional strength, hamstring strength exercises, calf strength exercises, and hip and trunk strength will be appropriate for this section. For dynamic balance, 3-way RDL progressions, Y balance tests, and rotation progressions are key for optimizing stability and balance. And for plyometrics, you can do double leg or single leg progressions of explosive drills. In this clip, we're working on some end range knee flexion, comparing it to the good side, and also performing some patella mobilisations and then retesting range of motion. My client did report less pain in end range of motion after some knee mobilisations. You have your vastus lateralis, your vastus medialis, and your rectus femoris muscle, all inserting at the patella joint. And the clinical correlation is patella instability, patella pain, and patella tracking on the femur. So just to finish off, we're doing some soft tissue release on these attachments and on these muscles, just to release any tightness, as my client did mention, some tightness in and around the knee joint. Here I'm using some muscle scraping tools just to get a little bit deeper into the tissues and to really get that nice release into the fibres to relieve the tension on the patella joint. Finally, just to wrap up, I'm applying some CBD muscle and joint balm to his kneecap just for that added pain relief. If you found this useful, please like this video and leave a comment below. If you are suffering from knee pain and would like some further information, feel free to drop me an email and I'll be more than happy to help. My email will be in the description box below.